Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. Being well informed is crucial in the fight against ovarian cancer. As the fifth leading cause of cancer-related deaths in women, it's vital for women to get regular checkups and talk to their doctor if they experience symptoms. If diagnosed, women and their physicians need access to specific information about their condition to determine next steps. Biomarker testing can help physicians understand more about a person's specific cancer, but it isn't always offered to patients. We're joined today by Dr. Erin Crane of Atrium Health Levine Cancer and Bobby, an ovarian cancer patient, to tell us more. Welcome to Health Professional Radio, both Dr. Crane and Bobby. How are you doing today?
We're good. Good morning. How are you?
Great. Well, my first question is for Dr. Crane. What are the latest statistics surrounding ovarian cancer?
Ovarian cancer is the 8th most common cause of cancer in women worldwide. And in the United States, we see about 20,000 new cases every year. Unfortunately, most women with ovarian cancer are diagnosed at a late stage because we lack effective screening methods for early detection. And that's why we're partnering with AstraZeneca this month to raise ovarian cancer awareness. When diagnosed at a late stage, ovarian cancer can be very difficult to cure and has a higher tendency of returning.
Recognizing these statistics, why is biomarker testing important in the fight against ovarian cancer?
Biomarker testing is important because it helps to identify a set of patients who are eligible for a specific type of drug called PARP inhibitors. PARP inhibitors the past few years have really been game-changing for ovarian cancer. The reason biomarker testing is important is that it identifies something called homologous recombination deficiency, or HRD, within the tumors themselves. And about 50% of women with ovarian cancer have HRD-positive tumors. In clinical trials, women who went on PARP inhibitors with HRD-positive tumors had a decreased risk of death and an increased amount of time before their cancer came back if it returned. So that's why biomarker testing is so important, is to identify patients who would be eligible for that particular class of drugs.
Now, Bobby, you're an ovarian cancer patient. How did you learn about your diagnosis, and how did biomarker testing play a role in your treatment?
My cancer journey started in 2021. In the early part of the year, I was having some pretty vague symptoms, some urgency and some bloating, and I just attributed it to getting older. But unfortunately, in June of 2021, I became acutely ill, and at that time I was diagnosed with advanced ovarian cancer. I went through chemotherapy, and during my chemo, my doctor recommended that I get some genetic testing, and when the results were returned, I found that I had HRD positive genetic testing, although I was BRCA negative. My doctor was happy that I had HRD positive status because she said this would open doors for me in my treatment. So it's very important that all women who do have ovarian cancer get this testing because there's many new developments that will help us.
Bobby, based on your experience and knowledge, what would you want someone to know who's been recently diagnosed with ovarian cancer?
Well, of course, it's a big shock when you're diagnosed with ovarian cancer. And it's important to corral all of the supports that you have. In my case, I used my family. I went online and really educated myself and helped myself advocate for myself. I also was able to use the social medias and nonprofit organizations. There are so many of them that have so much to offer a woman newly diagnosed.
And how are things going for you now?
I'm doing fantastic. I am in remission.
And that's really good to hear. I'm glad things are going well for you. And Doctor, what's the most important thing about treating this disease? And then tell our listeners where we can find some more information.
I think it's really important for women, especially since this is Ovarian Cancer Awareness Month, to go see their physicians if they're not feeling well and advocate for themselves, because most women with ovarian cancer have been having symptoms for months. It's often called the silent killer, but we know it's really not. And so if someone's not feeling well or something doesn't feel right, go talk to your physician or your healthcare professional. I would direct women to their physicians and healthcare professionals for further resources too. There's so much information out there online that it can be confusing. So talking to a physician about where to go to find more resources is the best piece of advice.
Dr. Crane, Bobby, thank you both so much for joining us here on Health Professional Radio and shedding light on this very important issue. Thank you so much.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Aaron Crane and Bobby. Audio copies of this program are available at healthprofessionalradio.com.au, also at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.